The next, glaucoma screening by non-mediatic fundus camera, an easy and effective tool by Dr. Anushri Agarwal.
Good afternoon, everyone. The title for my study is Assessing the Sensitivity and Specificity of a Non-Mediatic Fundus Camera for Glaucoma Screening. As we all know, glaucoma is one of the principal causes of irreversible blindness in the world, which constitutes for blindness in up to 8.4 million people and is expected to raise to 11.1 million by 2020. And since the typical visual field defects of glaucoma appear years after the onset of structural changes, a structure-based device for glaucoma screening can be crucial. So how do we detect early? An ideal screening test for glaucoma should be safe, sufficiently valid, acceptable to the people, fast and portable, and easy to administer and interpret. So we conducted this study to assess the usefulness of this non-mediatic fundus camera for glaucoma screening. We included patients between 30 to 70 years of age who were diagnosed with primary open angle or angle closure or normal tension glaucoma with relevant field defects. The control group were patients without glaucoma with a cup disc ratio of less than 0.5. The exclusion criteria for both study and control group were all the secondary glaucomas or patients with cataract or media opacity or any other posterior segment pathology. So this study was done at the Glaucoma Services of Arvind Eye Hospital, Pondicherry from August 2015 to June 2017. After approval by the Institutional Review Board, 276 eyes of 138 patients were taken in the study. So known patients of glaucoma presenting for review checkup or normal patients presenting to the outpatient department of Arvind Eye Hospital, Pondicherry underwent a preliminary examination. Then 2 undilated colored images of the optic disc from each eye were taken using the non-mediatic fundus camera. All the photographs were taken by a single technician who was well trained in taking photographs with this camera and was previously involved in a study for DR screening with the same camera. Then the pupils were dilated and a gold standard plus 90D biomicroscopic examination was done by a single investigator who was a senior glaucoma specialist with more than 10 years of experience. Then the images were digitalized and de-identified using random number generator by another independent investigator. These images were presented randomly to 2 masked readers who were neither involved in the clinical examination nor in the randomization of the images. Finally, re-identification of the images and tabulation of results was done, and the sensitivity and specificity of this undilated optomet images were calculated by comparing with the gold standard 90 diopter examination. These are few of the images using the non-mediatic fundus camera, in which we can see the good picture quality with the appreciable notching and the corresponding retinal nerve fiber layer defects as depicted by the arrows. These are few images in a patient with a nuclear sclerosis grade 2, in which we can appreciate the glaucomatous changes in spite of the hazy media. Coming to the results, on comparing the undilated optomet grade 1 versus the 90 diopter examination, 131 patients labeled as glaucoma on 90 diopter examination was also showed to be suspicious of glaucoma seeing the fundus images, and giving a sensitivity of 96.3%. And 138 patients who were labeled as normal people were thought to have not having glaucoma by the fundus images. Only 2 false positives and 5 false negative cases were seen. When we went back and looked at the images of these patients, the 2 false positives and 3 of the 5 false negatives had poor image quality, and 2 of the remaining had subtle glaucomatous changes which could not be picked up by the photograph. Similarly, with grade 2 versus the 90D examination, the sensitivity and specificity came out to be 94.9 and 97.9% respectively. So we conclude that the sensitivity and specificity for this undilated optomet camera was as high as 95.6% and 98.3% respectively. The strengths of the study include a large sample size. A senior single glaucoma specialist performed the gold standard examination, hence it limited the indoor observer bias. All the photographs were taken by a single well-trained technician, and there was masking. That is, both the graders were presented with randomized photographs and were unaware of the disease status of the patients. However, since we did not have any previous data, we performed this study only on the known patients of glaucoma with relevant field defects. We did not include the DISC suspects for evaluation. Hence, role of those non-mutatic photographs in these patients is yet to be explored. To conclude, Optimus SmartScope is a portable, handheld, non-mutatic device which seems to be a valuable tool for large-scale glaucoma screening. However, its usefulness in DISC suspects is yet to be tested. Thank you.